Hi, my name is Mackenzie, and I chose Med-Surg Nursing for my focus of career exploration for this summer. You're probably wondering why I chose Med-Surg, so I just wanted to give you a little bit of background on how I made that decision. So I applied for a PCA position last April at Methodist. I think it originally was a float position, but I ended up getting an interview on Fort Hamilton 2, which is the Med-Surg floor at Methodist. So after my interview and meeting everybody and kind of taking a tour of the floor, I knew that it was something that I was going to be interested in, so I was really excited when she offered me the job. So through working on the Med-Surg floor as a PCA, I've been given the opportunity to see and work with many different types of patients. And even though there are only certain tasks that I can complete as a PCA, the nurses on the floor have been really great about teaching me things when I have questions and giving me opportunities to see cool things, which has helped my love for Med-Surg to grow. So when I become a nurse I graduate next December, which is super exciting. I can't believe it's almost here. But when I get my license, I'm hoping to start out on the Med-Surg floor, provided that my boss offers me a job. But starting out on the Med-Surg floor will definitely help me in my future. As of right now, I would like to be a CRNA. That might change from now until then, but starting out on the Med-Surg floor will help me just to kind of build that strong foundation for my practice. And if I do want to become a CRNA, this will help me transition into critical care, which is required for the CRNA program. So my plan right now is to start out on Med-Surg and work there for a couple years, and then after that I'll no longer be a mentee, so my plan is to transition to critical care and work there for a while too. So for this course, we're required to come up with 4 objectives that we hope to meet by the end of the summer. So through the help of my contact, Becky Culp, which is the nurse manager on Fort Hamilton and my boss, she's really great, we decided that my objectives would be to examine the different certifications that a Med-Surg nurse can obtain, to understand the nursing process as it applies to a Med-Surg floor setting, to identify advancement opportunities that can come with a Med-Surg background, and to explore the advantages and disadvantages of becoming a nurse manager. So to kind of help me meet these objectives, I researched 5 articles pertaining to my objectives. These articles kind of help to guide the way for me for this course and give me some idea of what to expect and the best ways that I can meet these objectives. So the first article I found was about the leadership role of Med-Surg nurses. So this article just kind of discusses the advantages and disadvantages to being a Med-Surg nurse. So they interviewed some nurses, obviously, for this article, and many of them said that they didn't want to assume a leadership role like this just because they felt like they wouldn't always have enough time for the role. No one would be willing to work with them once they became more of a leader. They wouldn't feel valued, and some of them felt like they couldn't control a group, which is a huge part of being a leader. However, many of the nurses also said that there were advantages to such a leadership role, including higher pay raise, helping to advance them in their career, and they were given the opportunity to actively make a difference in the lives of their patients. And even though for some nurses this seemed like an overwhelming role, Med-Surg nurses definitely have the education needed to assume this type of position. So the next article I found was titled Ethics, Law, and Policy, Ethical Concerns in Med-Surg Nursing. So this article kind of talked about different dilemmas that a med-surg nurse might encounter throughout their practice. It also described in detail how to help med-surg nurses deal with these different dilemmas. Not only did it talk about how nurses should keep their patients' best interests in mind and assess their beliefs and values, but it also talked about how the nurse should assess their own personal beliefs and values to make sure that they're congruent with the work that they're doing. It talked about how they should practice with a safe and quality focus, perform as effective members of the healthcare team, maintain confidentiality, tell the truth to support informed consent, and call an ethics consult when they themselves, their patients, or their families need the support. These are like kind of the key issues that surround the article and how to deal with them. And when they're followed, these will help the nurse to get through these types of dilemmas and build a great foundation for their nursing practice. So the next article I found was how med-surg nursing should be considered a specialty. Since its development, med-surg nursing has changed so much. The article discusses like the lack of recognition kind of that med-surg nurses receive and how this specialty helps to develop them in their careers. It discusses 6 main objectives that must be met, including making sure that the client's health needs are met and outcomes are improved, that the specialty enhances existing aspects of professional practice, the expansion is lawful and appropriate for the context, the expansion of the scope of practice is based on appropriate consultation and planning, the registered nurse expanding his or her practice is already practicing at an advanced level. They have the appropriate education, of course. They're assessed as competent and they understand the degree of accountability that will come with this certification. Lastly, it talks about how one of the aspects that should be met is that a competent health professional has assessed the competence of the registered nurse who will be practicing this way. And ultimately, the focus was how med-surg nurses need to feel that they're valued, and more focus needs to surround providing the best patient care possible. The next article I found was about the different certification opportunities that med-surg nurses can have. So this was a little bit confusing for me at first because of all of the acronyms, but basically there are 2 different accrediting, I guess you could say, centers that offer these certifications. So there's the American Nurses Credentialing Center and the Med-Surg Nursing Certification Board. So the Med-Surg Nursing Certification Board offers med-surg nurses the title of Certified Med-Surg Registered Nurse, while the American Nurses Credentialing Center offers the title of being BC, which is Board Certified, or C Certified. So when it comes to the BC and C certifications, typically RNs with bachelor's degrees are the ones that get board certified, and nurses with associate's degrees and diplomas get certified. However, this has changed since the article was written, and regardless of their degree, all nurses have the opportunity to be BC or board certified. This article discusses the different requirements that must be met by med-surg nurses before they take these certification exams, including taking the exam that contains clinically based questions and being recognized by the Academy of Med-Surg Nurses. The last article that I found kind of meets my objective for relating the nursing process to a med-surg floor. It is evidence-based practice surrounding negative pressure wound therapy, which is something that I have the opportunity of seeing a lot up on my floor because we have many patients with wound vacs, which I find very fascinating. Some people don't, but for me it's cool. So this article surrounds how evidence-based practice is used by med-surg nurses to guide them in caring for patients with negative pressure wound therapy. So it discusses the different types of wounds that can be treated using negative pressure wound therapy or a wound vac, how this type of therapy promotes healing, how the device is applied, risks that can accompany the use of this type of device, and education that should be provided to the patient and their caregiver upon being discharged from the hospital if they are going home with a wound vac. So when using the nursing process to guide them in using wound vacs, when it comes to assessment, this includes verifying the order, ensuring that the patient is positioned properly, assessing and treating pain before applying the wound vac, and inspecting the wound for any abnormalities. When it comes to diagnosing, nurses kind of have to figure out what risks or diagnoses that can develop throughout this process and implement proper interventions to ensure patient safety. So in planning, this is just kind of gathering the necessary supplies and being in communication with the patient and their family members so they know what to expect throughout the process. When applying this device, it's important that we make sure that we're following the proper policies and procedures of your facility. And then to evaluate, it's just kind of best that the nurses ask questions like, has the device been applied properly, and is it working appropriately, and how did the patient tolerate the procedure? So those are just some articles that I've found relating to my objectives for this course. So to achieve personal and professional growth throughout this experience and to get the most out of it, I made sure to research prior to my shadowing opportunities so I could ask questions that would help me to get the most out of this experience. I also shadowed both a lead nurse and the nurse manager on the floor so that way I could get a couple different perspectives surrounding med-surg nursing and get each individual's take on the specialty. So I had a lot of fun during this opportunity, and in my role as a PCA, I kind of don't get to see the different roles that the nurse and nurse manager are performing throughout the day. I know they're always super busy, but it was kind of cool to be able to take that step back and just focus on what they do. So the first day I spent shadowing was spent with one of the unit's lead nurses, and we spent 8 hours together. So one of the things that we talked about was the different certifications that a med-surg nurse can obtain. So this helped me meet my first objective. So she explained to me that there are the med-surg certification and the bariatric certification that med-surg nurses can obtain. That's just a few that she gave me. So she said that having these certifications helped her and other nurses on the unit to kind of provide best care to their surgical patients. She talked about the different criteria that they all had to meet before they were able to take the exam. For instance, she talked about how most certifications require them to have practiced as a licensed nurse for 2 years before being able to take the exam. So following the unit's lead nurse for 8 hours allowed me to see all of the different roles that she performs throughout the day, which to me was kind of overwhelming because I don't know how she kept up all the time, but she did a really great job functioning as a team member who helped out everyone when she could. So her role throughout the day was basically just to help out other nurses with tasks that they needed help with. She kind of focused as like a lead task, but also she did some of the roles of a lead nurse, such as working on patient discharges. She did some patient rounding just to kind of see how everyone was feeling about their stay and the care that they've been receiving. In the beginning of the day, she met with the nurse manager to just kind of discuss how the day was supposed to go. I know that never happens, but they just kind of talked about how many surgeries they saw coming, how many patient discharges they were supposed to have, if they would need to transfer any medical patients to different floors so that way we would have room for surgical patients, just kind of stuff like that. So she talked about how being exposed to a role as a lead nurse has opened up many doors for her. She has been working as a nurse on the med-surg unit for probably 4 years now, I think she said. So in that time, she has been offered many other positions on other floors because they have recognized the hard work that she does and how great she is at her job. So they all want her to come and work for them. So she also explained how building a foundation in med-surg nursing will give us all many opportunities to work with many different types of patients that you might not have the opportunity of caring for otherwise. And pertinent to my situation, she talked about how other areas in the hospital and other fields require a med-surg background to be able to work for them, such as the critical care. Say I was to apply for a job and another person was to apply for the job on the critical care unit, and I had the med-surg background. She said that they're likely to choose the nurse with the med-surg background over the other nurse. For the next 7 hours of my shadowing, I was able to follow the unit's nurse manager, which I'm very close with her, and we had a really great day together, and I was able to see all of the many different roles that she takes on. These people are busy, let me tell you. So one of the things we talked about to meet my objective was the different ways that you can relate the nursing process to a med-surg floor setting. So she talked about how recently they had been having problems as a floor with falls. Now, per year, we are only allowed so many falls, and I think it's 12, she said. So for July, we had already had 8 as a floor, which is not good. So she talked to me about different ways that they were able to use the nursing process to kind of help fix this issue. So using the nursing process, nurses have to score their patients to determine whether or not they're a fall risk. So some things that they might look at are the medications they're taking, their current health status, and other things like that that may affect their mobility. So if patients are at an 11 or above on the Hester Davis fall score, they are labeled a fall risk. On this unit, they give all patients a yellow fall risk bracelet, and they also place a sign outside the patient's door that kind of lets everyone on the healthcare team know that they are a fall risk. She said the main problem that they had been having, why they had so many falls, was that the proper bed alarm was not being plugged in the patient's room. So they have implemented a new column on the CNA sheet and the activity boards that are visible to everyone to let everyone on the healthcare team know that the patient is a fall risk and that they need to be sure that they are plugging in their bed and chair alarm at all times. She also talked about how they do monthly challenges, which I've had the opportunity to be a part of. They're super fun. So she was talking about coming up with a monthly challenge, like kind of like a fall prevention challenge. So whoever has like the least amount of falls or something like that per shift would get like a reward, which is kind of cool and kind of a way to get everyone on board with making sure that they are keeping the patient safe. To meet my last objective, we talked about the advantages and disadvantages to her job. She talked about how the main disadvantages to her job were not being able to be as involved in patient care as she would like because it seems like she has so much paperwork to do all the time. But to still kind of get that patient interaction, she takes the time to do patient rounding, just as the lead nurse does, to check in with the patient. She mainly focuses on inpatient surgeries. There's not a big focus on outpatient surgery rounding because they're not there as long. Not that they're not important, but she tries to focus on the patients that are having a longer stay on our floor. And another disadvantage to her position is kind of just having to rely on other team members to get things done sometimes, which can be a tad bit frustrating because she said that it seems like the important things that could risk patient safety aren't always getting done as efficiently as they should, so she has to stay on the other members of the patient's healthcare team to make sure that they do get done, which can be stressful for her because she's worried about the patient, but it's also out of her control in certain instances. And even though there are disadvantages, she said that overall she really loves her job and there are many advantages. She said that now she feels like she has more of an opportunity to make a difference, and it kind of leads to a greater sense of personal achievement. Not that nurses aren't able to make a difference, but she said that in her leadership position, she has the ability to take it to the right people so she can make sure that things get done. So overall, I am really pleased with this experience. I'm really glad that I had the opportunity to shadow on my floor to kind of get a glimpse into some of the roles that I may be able to take on in the future, and to see the roles that my coworkers are performing that I might have not known. So that's kind of why I chose med-surg nursing, and in the future I plan to stay on top of these opportunities that are presented to me on my floor by asking questions and learning as much as I possibly can. So, thanks.